talked about some additional services that you offer. So I just out of curiosity, if you could talk a little bit about hypnotherapy, acupuncture, yoga, massage, herbal medicines, and how these play a role and how you do offer them to patients for their treatment options.
Yeah, so Dr. Mensah, you want to start with herbal therapy, and then I'll pick up with acupuncture and hypnotherapy.
Absolutely. So a lot of the botanicals or herbal therapies that we use, as you were just discussing, can be used for the side effects of ADTs. That is how our body uses fats and sugars. That can be also our mood changes. That can be also things like bone density as well. When we're using these botanicals or herbal therapies, one thing that we always like to do is making sure they're well sourced, because sometimes people online, as if we Google a lot, can sell several types of things that they call natural therapies, several types of supplements. And we don't really have a way of regulating the sourcing and the quality of these products. So that's why I feel like it's super, super important to see doctors like myself and Dr. Roy, because one, we know how to use these botanicals. We know how to use these in a cancer population as well.
Is there a trustworthy resource where you can look and tell whether this botanical that they're using is from a trusted authority since they're not FDA regulated?
No. So the government does regulate supplements, but they regulate them under the USDA, like a banana. So it's almost impossible for the average person on the other side of this table to know if, let's say they're taking arginine for erectile dysfunction, if that is sourced properly, if what it says on the bottle is what's in the bottle. However, we, as part of our doctoral training, have a really in-depth understanding of the companies that manufacture supplements and which companies are willing to go through an FDA-like process for verification of ingredient source, efficacy, for control. They allow third-party testing, batch testing, and we only recommend supplements from those companies that are pharmaceutical grade. The unfortunate thing in this country, Dr. Lutz, is that patients can't buy directly usually from those manufacturers. They usually need a doctor's recommendation or need to order through a doctor's NPI. So they do have to see someone like yourself or myself to be able to source those kinds of supplements. So there is a risk in just taking things over the counter, as Dr. Mensah said, or Googling something and thinking it'll be of benefit to you, because there's also, let's just take one supplement as an example. Let's use fish oil. Fish oil, is an excellent therapeutic for cardiovascular health, right? To manage lipids, to lower inflammation in the system, which has been shown clinically to help with slowing progression with prostate. The problem with fish oil is multifold. One, where are we sourcing these fish from? They're usually large cold water fish that carry other contaminants in their tissues. So when we're taking that supplement, we're taking those contaminants as well. The other problem can be if the person was a previous smoker and they're taking high doses of fish oil, it can result in cancers that are higher grade at diagnosis or progress faster. There are large trials that looked at fish oil in high doses and in fact found, like the SELECT trial, found that high doses of fish oil in men prior to diagnosis resulted in more aggressive disease at diagnosis. And then the other problems with fish oil is it can't be combined with certain kinds of therapies because it either potentiates the therapy, meaning makes it work more effectively, or it'll interfere with the therapy. Like, for example, I'll take something else, green tea. A lot of people know that green tea is an excellent therapeutic and people think of it as cancer fighting, but it uses the same pathway in the liver as some of the androgen deprivation therapy does and competes with it and can lower efficacy by sometimes 60%. I don't want people to think they shouldn't take natural therapies. I want them to know when you're taking natural therapies, it has to be looked at from a skilled perspective in terms of what's right for you, where are we getting it from, and how does it play nicely with your current treatment from urology or your oncology.
Okay. So And Dr. Roy, I was going to also now have you go on a little bit to talk about the hypnotherapy, acupuncture, yoga, massage.
Yeah, so if you go on pubmed.gov, which is where, when patients tell me they're on the internet, that's where I like them to go. I prefer that they go to pubmed.gov and put in the therapeutic that they're interested in. It can be anything from blueberries to acupuncture, and capitalize A&D and put in prostate or prostate cancer. You're going to see a lot of data there. And then if you click on the left on clinical trial, it'll filter that data for the data that's been shown in human populations, usually in a hospital setting. Acupuncture is excellent for nerve pain, and it is well evidenced for pain in general. There's been some smaller, less robust studies looking at acupuncture for prostatitis. So when the prostate is enlarged or inflamed, and we don't know that it's going to progress, the acupuncture has been used for that as well. Those studies are mainly in Southeast Asia. But well established for pain syndromes and nerve problems. Hypnosis we don't use in our clinic, and I don't want to speak out of my purview and talk about something I don't know too much about, but what I will tell you is we use a lot of guided visualization and mindfulness meditation techniques. So all of our therapists are trained in mindfulness-based stress reduction, which is a strategy of bringing your conscious mind to your experience. It has good data that it helps with pain, sleep, depression, anxiety, and even outcome. And the third one you asked about was massage. Our massage therapists on staff are oncology certified. They've all been practicing for a long time. They're good at creating safe space. But they also know how to work with patients on bringing themselves back into their body. When we're diagnosed with a disease, we can get in this sort of like combative place where we're fighting the disease and we disassociate a bit from ourselves. And massage has good data that helps bring people back into their bodies, helps people bring people back into the present. And there's even data that therapeutic touch does improve prognosis with cancer globally.